Doc, good morning, and thanks so much for coming in this morning. So, do you agree? I mean, many experts say that we are living longer and people are healthier well into the older years. Is that, have you seen that in your experience?
So it is true, the life expectancy is increasing. Women live on average to 67 years and men to 61 years. And in my hospital, we're seeing a large proportion of much older patients.
So what would you attribute that to? Why? Why are we living longer?
I think socioeconomic standards have increased. People have more access to health care. People are living a more healthy lifestyle. You can treat a whole lot of the conditions that weren't treatable before. And people are more focused on their health now. It's an important part of their everyday lives.
So, in your experience, when do we start to see the body kind of slowing down and getting older? Is it able to pinpoint when we actually start to age?
So this is a question that makes me very unpopular, because old age technically starts at 65, which is very young.
It is young, yes.
It is young. In some countries, even 60. So that's when the changes start.
All right, let's talk about those changes. How does it start? What might we start noticing in our bodies at that age?
So, I mean, it's very subtle at first. Some people are absolutely fine well into their 90s, but in general, the body composition itself starts to change. So the people will tell you they're not able to lose so much weight. They carry more weight around their middle. The water component of the body shrinks, so people are more prone to dehydration. Certain things inside the body, like the barrier between the brain and the blood, starts to diminish, so people become a lot more sensitive to drugs. Kidney function diminishes a little bit, liver function as well. Very subtle changes at first, and then when things start going wrong, it all comes together.
Well, if an expanding middle section is signs that I've started already, because I'm already there.
But we're all old.
We all are. So that's in your 40s, I would say, that kind of shows itself. So what are the common illnesses, if you have to put names to them now? What are the illnesses that might start to develop at that as we get older?
So as you get older, you start getting your very common conditions like hypertension. A lot of people get diabetes in middle age, hypothyroidism, and then you get the condition specific to older age. Your bones become more brittle and you get osteoporosis. Arthritis is a lot more common. Dementia is much more prevalent. People start having mobility issues, and then falling is a big problem. Urinary incontinence is one of the big issues as well.
In terms of the treatment for these conditions, I mean, people associate old age with somebody who smells like, Vicks, or smells like what is the other ointments that we use? Wintergreen, yes, that smell like wintergreen, and you carry around a big pill box. Is that necessarily what happens in terms of treating? Do we have to take, like, I don't know, a handful of pills every morning or throughout the day to get through this?
So we prefer people not to take so many pills. The less, the better, unless you really need them. But I mean, obviously, if you've got high blood pressure, you have to treat it because you don't want the complications later on. But things like to prevent falls and to prevent osteoporosis, it's simple things like drinking enough calcium or eating enough calcium in your diet, exercising, keeping healthy, making sure that your hearing is good, that your eyesight is good. Just some very simple measures to ensure that you live happier and healthier for longer.
So basically get down to those physical checks. But I would imagine that you shouldn't wait for these things to start developing in your body. Should we start a little earlier? I'm in my mid-40s. Should I start already to sort of put a lot of focus on preventative and also getting those checks done so I know what's happening in my body from now?
Yes, so actually the most important thing is to control all the risk factors for future disease in middle age. So when you're in your late 30s, 40s, 50s, that's when you want to make sure that your blood pressure is controlled, that your sugar is controlled, that your weight is controlled, that you're taking care of yourself, you're doing a lot of exercise, you're eating a healthy diet.
So we should be exercising also well into our 60s. I mean, I just heard yesterday about a man who's well into his 60s. He runs 20 kilometers every day for 5 days. Is that risky?
You know, if you're well and you're healthy and you don't have any medical conditions, it's probably really healthy. But if you are not as stable and you've never done it before, I wouldn't suggest starting with a 20
Don't start running a
kilometer
marathon
run.
in your 60s or when you turn 65. What are I mean, we are going to be chatting to a biokineticist a little later on in the program, but I'd like to hear from you in terms of what are the safer options when it comes to people in that age group or our seniors. Are we looking at more things like yoga and Pilates, stretching exercises, as opposed to, you know, the high risk cardio maybe?
So strength and toning is really important. You want to get the core muscles really strong so that if you do, you know, fall, you're able to get yourself up, that if you are a bit unsteady, you're able to right yourself. And then things like walking, which is cheap and simple, and you can do it with friends. It's a nice social activity as well. Maybe not in COVID times.
No, not in this time.
But generally.
You are at Helen Joseph Hospital. That's where you're based, Doc. So you said that you don't like people to sort of start taking a lot of pills just to, you know, to deal with illnesses. What is the approach you take to your older patients in terms of treating whatever it is they've come down with?
So we do something called a comprehensive geriatric assessment, where we take into focus everything, their social circumstances, physical, mental, you know, just a whole sort of comprehensive assessment of the patient. And then we try and tailor treatment based to what their problems are. So, I mean, if there's a medical condition and they need treatment for it, I'll definitely prescribe a pill. But I don't want somebody who may be a little bit confused to take 75 pills at 5 points during the day. Try to simplify it and try and do a few, you know, prescribe exercise, prescribe diet, prescribe, ask the other allies for a bit of help.
Is there a certain time as you get older that you would say to someone, look, now is the time maybe for you to not be living alone, or a couple to not be living, you know, would you go and live with a daughter or a son or a relative, or perhaps you know, in a facility? Is that the advice that you might give someone at a certain age?
Yes, so I look at something called activities of daily living. So if somebody is able to do all their activities of daily living, they can socialize, they've got their bridge on a Monday and golf on a Tuesday, and they're coping, they can live independently alone. If somebody is able to do the cooking and the shopping, but they're just having a little bit of trouble, maybe just a bit of help from a family member or from a carer once or twice a week. But once you're not able to do the cooking and the shopping and organizing transport and taking your own medicine safely, it's very difficult and dangerous to stay
I mean, we
alone.
often hear people go, all people should not be driving after a certain age. But I mean, it's quite specific to every person, and that changes. Now, a bit of an embarrassing question here, because I mean, I have in-laws and parents, you know, well into their 60s and 70s. But when it comes to sexual health in your old age, what have been your observations, and what would be your advice?
You know what? I think people must do whatever makes them happy. If they are sexually active and they're healthy, go for it.
Okay, we often see those movies about what happens in those old age homes, and yeah, so it does happen. It does happen, and I think just to round up, just a last bit of advice, I suppose, from you for somebody who might, you know, start to feel a bit challenged at this point. I can't move the way I used to. I can't see, you know, properly like I used to. I'm going to need different types of lenses and bifocals and all of that. Just sort of the sort of a pep talk, I suppose, for somebody who might be starting to feel this at this moment.
Look, we all get older, and it's a beautiful thing to age. I mean, that's what we're aiming for. We want to live longer, so you just have to embrace it, and you have to take each change as it comes and adapt your life around it.
Okay, Dr. Lara Greenstein, thank you so much.